stories, and government has promised to complete the construction of 11 health facilities across the country before the end of 2020. That's according to the Health Minister, Kweku Agyeman-Menu, speaking during the sword cutting for the construction of a 400-bed maternity and gynecology facility at the Korle Bu Teaching Hospital. The minister stressed that these projects, which are not included in Government Agenda 88, are at various levels of completion and would be commissioned in Bekwai, Tepa, Buipe, Somenya, and some 7 other communities.
We have come a long way in building our healthcare infrastructure through successive governments, but the gap remains huge and still needs to be filled. As you may be aware, the government's delivery program will see the completion of 11 healthcare facilities by close of the year at the following locations within the country: Somenya, Weta in the Volta region, Sola Tinakalba, Bupe and Tolong. Bekwai District Hospital will be completed, Tepa is about to be completed, Nsoko will be completed, Trifopras will be completed, Kumaku will be completed, and from now we're even getting some place ready for case management for coronavirus. So all these projects, Mr. President, you will have to commission them before the elections.
Now, on the new 400-bed facility at the Korle Bu Teaching Hospital, President Akufo-Addo said the project is in fulfillment of a 2018 promise he made to the management of Korle Bu to help reconstruct the block to better position it to facilitate Ghana's progress in quality healthcare delivery. The 145 million euro facility to be constructed by Meshes Hebedi JV will replace the dilapidated 6-story maternity building, which is currently being used.
Cut the sword for the construction and equipment of 2 major facilities, namely a 12-story, 400-bed maternity and gynecological center and a 2-story, 101-bed urology and nephrology center. The commencement of work on these 2 projects, in addition to the reactivation of construction work on the abandoned 750-bed maternity and children's block at the Komfo-Anokye Teaching Hospital in Kumasi, will significantly reduce maternal and neonatal mortality rates in our country. They are also further testimony to the commitment of government to improve our country's health care infrastructure and move us steadily towards the goal of achieving universal health coverage for all. Korle Bu, over its 97 years of existence, has served as a center of excellence in teaching, research, and the provision of high-level specialized healthcare services to Ghanaians and to persons from beyond our shores. This hospital, which is the 3rd largest in sub-Saharan Africa and the leading referral center in the country, is challenged with inadequate infrastructure, equipment, and cutting-edge technology to enable it respond adequately to the ever-increasing demand for its specialist services. Indeed, on my recent visit to Korle Bu, when I commissioned the intensive care unit of the National Reconstructive Plastic Surgery and Burn Center for the hospital, I was struck by the poor state of the maternity block. I promised to help remedy the situation, as the current state of the building is not fit for purpose. Today's ceremony is a fulfillment of the pledge I made.